It's a fact of life that everyone's going to have a scar at some point. It's just impossible to avoid the traumas that lead to those things. Now, once you do have a wound that's going to develop into a scar, what are the best treatment options for it? Well, I like to recommend the following for my patients. The first is to keep things moist during the healing process. We know for a fact from our resurfacing techniques that moist wounds heal faster. What I mean by a moist wound is not something that's just saturated in fluid all the time, but rather it's coated with an antibiotic ointment. I personally prefer to use bacitracin, but I would recommend you use whatever your physician recommends. The benefit of doing that is it will shave off a day or two of the healing time, also known as reepithelialization, where the edges of your wound are coming together. It's also very important to keep the wound clean. I like to have my patients use hydrogen peroxide to clean their wounds several times a day. This accomplishes two things. One, it helps to act as an antiseptic, and two, it also helps to remove the crusts, which are a natural development that the body makes anytime there is an incision. It begins to weep a little bit of an amber color fluid. That fluid then develops a crust, also called a scab. You don't want to pick a scab, but by having the hydrogen peroxide help dissolve those particular areas, it allows the wound to close faster and heal a little bit better. Once that area has completely healed over, it's important not to continue to put either the hydrogen peroxide or the bacitracin ointment on it, as it can irritate the intact skin. So then people ask, well, what can I do to get the best scar over the course of the year? It's important to realize that the scar is going to be improving itself over the year on its own. The studies have shown that liquid silicone-based products or silicone-based products can improve a scar. There are several on the market out there, and it's important to see if it does in fact have silicone in it. The next important factor is to keep it away from the sun. If your scar gets a tan, then that tan is going to stay there year-round, even as the surrounding area loses that tan. So it's important to use a sunscreen product once the wound has completely closed. The other thing to consider is that scars tend to defend themselves. So a scar that's under tension, meaning things are pulling it apart, is going to form more scar. So there are certain areas of the body that are more prone to that, but if you can prevent tension from being on there, such as lifting weights on a scar that's in the area of the neck, in the immediate aftermath of your incision or your trauma, it can also improve the scar. There are several treatments that can be done by facial plastic surgeons or other healthcare professionals, such as lasers, dermabrasion, repositioning the scar if it was made in a poor position from trauma in the first place, some creams, injections, and other various treatment options. In order to get the best treatment, I always recommend you follow up with one of your healthcare professionals, such as a facial plastic surgeon.